Hi, I'm Jennifer Smith.
And I'm Melba Jones.
And we are Women's Healthcare in Black and White. We planned this a while ago, and we have a series of videos coming out soon about women's healthcare and human sexuality. But right now, we're in a pandemic crisis, and we felt the need to kind of deal with that, especially for the women out there who happen to be pregnant right now. So let's talk a little bit about COVID-19. The symptoms are those of a really bad cold. Honestly, that's what this is. Coronavirus has been around for a long time. It's a nasty cold.
Yes.
This is a new and novel strain, and that's why it's hitting us all so hard. But these are the symptoms you're going to get. Seems to start mostly with a sore throat. A lot of people get fever. A lot of people get a cough, and it can be dry or it can be productive. And a lot of people find that they get short of breath, and that's what sends most people to the hospital is difficulty breathing. When the way that you decide whether or not you need to go to the hospital is how severe are your symptoms. Please, please don't flood the ER if you have a bad cold. But definitely seek emergency care if your fever runs over 103 and you can't bring it down with Tylenol. Or if you're having difficulty breathing. And that may look a little different in some people. That could literally be gasping for breath, but it could also be bluish tinge to the lips. It could be confusion or difficulty waking somebody up, or it could be a persistent pain in your chest that you can't take a deep breath with. If you have those symptoms, you definitely need emergency care. But if all you have is a really bad cold, practice social distancing, cover your mouth when you cough, and for the love of all that is good and holy, wash your hands.
Please wash your hands.
Melva's going to talk a little bit about what this means for pregnant women.
Okay, so as far as pregnant women, the things that the CDC has put in place in most hospital facilities right now, if you are close to delivering or will deliver in the middle of this crisis that's going on, be prepared that you will not be able to have as many visitors as maybe that you plan. Most facilities are limiting visitors to 1 or 2 people. And that means for the labor and delivery process as well as postpartum. So for the most part, you need to go ahead and try to plan who you're going to have in the delivery room with you. And if that facility is allowing 2 people, who that second person will be. But go ahead and prepare your family, your children, that they will not be able to come to the hospital. It's no point in them even coming to sit in the waiting room. They're just exposing themselves to the virus. So it is best to just stay at home. After you get your 1 or 2 designated people, you can FaceTime, send videos of the baby. But it is best that you tell your family and your friends to just stay at home outside of those 2 people that you are allowing into your delivery room.
And my hospital is just 1 person.
Right. Yeah. So that's why I say you do need to call the facility where you're delivering to try to get that information ahead of time. They should be able to give it to you. Like we said, it's most facilities are 1 to 2 people at this time. Also at this time, right now, as of March 21st, things are changing daily, but as of March 21st, there has not been any virus detected in amniotic fluid or in breast milk at this time.
Please feed your babies.
Please feed your babies your breast milk if you are planning to breastfeed. Just because breast milk is amazing, it provides good immunity to things. And also there is a shortage of formula right now. So for those moms who are bottle feeding, try to save that formula for those moms. If you are breastfeeding currently or have plans to breastfeed after delivery, please keep continuing with those plans. As of right now, there are no recommendations to not breastfeed your baby during this coronavirus pandemic.
You will be screened when you get to the hospital for your current health. They're going to check your temperature. They're going to ask if you've had any travel or contact with people who are infected. We are also screening at my office, and we are not allowing any guests or visitors back with any of our patients right now. Yes, that includes the father of the baby. And yes, I do mean during your ultrasound. We're asking everyone who is not the patient to sit in the car. Don't even come in the waiting room. We're trying to limit how much exposure is out there. Right now, we are very concerned about the health of all of our patients. We want to keep these pregnant women and their babies as healthy as possible, but there does not seem to be any particular risk to pregnant women. Unlike the flu, which pregnant women are definitely at a higher risk for, coronavirus doesn't seem to be hitting pregnant women harder than anybody else. But We would like to keep you healthy if we can, which means keeping you away from people who have this virus. So please stay home, cover your mouth when you cough, wash your hands. Let's try to keep you healthy as possible. There's been some debate. I don't know if you've had this debate among your colleagues about whether or not we induce these patients. Right now, we're saying no. We think your baby's safer inside than it is out.
Right.
But if you do go into labor, we're going to do our best to keep you both healthy. And that means we're going to be wearing masks, we're going to be washing our hands, and we're going to ask you and your guests to do the same.
And after delivery, when you do go home, please try to keep those same practices in place. Just because you're home, do not let large crowds come into your house. Even though CDC is recommending 10 or less at this time, we probably would still encourage you to keep it to those 1 or 2 visitors you had at the hospital.
Yes.
Just until we get out of this pandemic phase, because you never know who might bring something into the home. So even after you leave the hospital, try to keep your visitors down as much as possible. I know this is a joyous time and everybody wants to see the baby, but we can share pictures, social media, you can send text messages, you can FaceTime. There's other ways that they can see your newborn without exposing you all to possible germs.
Hopefully we have a long, long time for Aunt Edna to kiss your baby.
Right.
It doesn't have to happen today.
It does not.
We have more videos coming down the pike that are a lot more designed to address women's healthcare issues, but we really felt like we needed to talk about this. So this one's going to come up first, but stick around, like, comment, and subscribe. Stay tuned. We've got a lot of information coming at you.
And please follow us on Facebook, Instagram, and Twitter.
Be well.